Welcome to our explainer on big data and healthcare. Today, we're diving into how this avalanche of health data is being turned into actions that can literally save lives. Let's get right into it.
So just imagine this for a second. What if your doctor could look at your data and see an illness coming days, maybe even weeks, before you even felt the first symptom? I know it sounds a little bit like science fiction, right? But it's actually the promise of big data. And it's all built on an amount of information that's almost impossible to wrap your head around.
And when I say impossible, I mean it. Just look at this number. Back in 2011, and that was a long time ago in tech years, the US healthcare system was already generating 150 exabytes of data. For perspective, 1 exabyte is a billion gigabytes, and that number is just exploding. We're talking about zettabytes and yottabytes now. It's this sheer mind-boggling scale that makes these predictions possible.
But you can't just flip a switch. Handling this data avalanche isn't just about buying more hard drives. The challenge really boils down to 4 key ideas, what people in the industry call the 4 Vs. Let's break down what they actually mean. So first up, you've got volume. This is the obvious one, right? The sheer scale of it all. And it's not just your basic patient records. We're talking about every single X-ray, every 3D scan, every piece of a genomic sequence. And new stuff like data from wearable sensors, that's just fueling this exponential growth every single second.
Next up is velocity, and this is all about speed. Think about an ICU. The data streaming from a heart monitor isn't just a number to be filed away. It's a real-time signal that could be the difference between life and death. This information is flowing constantly, and decisions have to be made in a heartbeat. The real game changer is being able to analyze that data as it's happening.
Then we've got variety. And let's be honest, healthcare data is messy. It's a total mix. You've got neat, structured data, like lab results, sitting right next to completely unstructured stuff, like a doctor's scribbled handwritten notes, an MRI scan, or even something someone posted on social media about their symptoms. The real challenge is getting all of those different formats to play nicely together.
And finally, and this one is probably the most important, is veracity. This is all about trust. Is the data accurate? You know the old saying, garbage in, garbage out? Well, in healthcare, bad data can have absolutely devastating consequences. So this information has to be credible, it has to be precise, because actual lives are on the line.
Okay, so we've got this gigantic, fast-moving, messy pile of data. So what? What do we do with it? Well, this is where analytics comes into the picture. Analytics is the tool that lets us sift through all that chaos to find the life-saving signal that's hidden in all that noise.
And finding that signal, it's incredibly valuable. I mean, just look at this number. According to McKinsey, just applying big data analytics could save the US healthcare system over $300 billion every single year. That's a truly staggering number. So you have to ask, where is all that savings supposed to come from?
Well, this chart gives us a pretty good idea. The biggest chunk, about $165 billion, comes from this making clinical operations better. Finding more efficient, more effective ways to treat patients. Another huge piece, $108 billion, comes from making research and development for new drugs and treatments a whole lot faster and cheaper. And the rest comes from things like public health.
But this is about so much more than just money. This is where it gets really exciting. By analyzing millions of patient profiles, we can start to predict who's at risk for a certain disease. We can compare treatments across huge populations to see what actually works best. This is the stuff that can reduce hospital readmissions, get new drugs to market faster, and even catch fraud in the system. The potential to improve patient care is just immense.
Okay, this all sounds great in theory, but how does it actually work, right? How do you go from a doctor's note or a heart rate sensor all the way to a prediction that saves someone's life? Let's take a quick peek under the hood.
Now, I know this chart looks a little complicated, but the idea behind it is actually pretty straightforward. Over on the left, you've got all that raw data pouring in from tons of sources, electronic health records, labs, you name it. That messy data gets pulled together and transformed into a language that a computer can actually understand. And finally, it gets fed into these super powerful analytics platforms that can spot patterns that no human ever could. And here's the most important part to remember. That whole complicated process, it's all designed for one very simple, very human purpose. It's about turning that flood of data into a clear, actionable insight that helps a real doctor improve a real patient's life. That's it. That's the goal.
So, let's move beyond the theory and the charts. Let's look at some incredible real-world examples where this technology is already out there, making a huge difference.
I mean, talk about high stakes.
In a neonatal ICU, catching an infection even a few hours earlier can be absolutely critical. Well, one hospital found a way to get an unbelievable head start.
So at the Hospital for Sick Children in Toronto, they've got a system that is constantly analyzing the real-time data streaming from the monitors on these tiny newborns. It detects these incredibly subtle patterns that are totally invisible to the human eye, and it can flag a potential infection a full 24 hours earlier than they ever could before. Think about what a 24-hour head start means when you're talking about saving a newborn's life. It's incredible.
Sometimes, the biggest breakthroughs happen when you can finally connect the dots between things no one ever thought to connect before. This next example is a really famous one in the field.
So Kaiser Permanente decided to link up two different kinds of data, clinical data and cost data, across millions of their patients. By analyzing it at this massive scale, they uncovered dangerous side effects of the painkiller Vioxx. It was a pattern that was basically invisible at a smaller scale. And the result? Vioxx was pulled from the market, which probably protected countless people from harm.
Big data isn't just for looking at one patient at a time. It can also help us understand the health of an entire population, like, say, tracking and predicting the spread of the flu.
So the traditional way this works is we wait for official warnings from organizations like the CDC. But researchers at Johns Hopkins tried something different. They analyzed public data from Google Flu Trends, what people are searching for, and they found they could predict a spike in flu-related ER visits a full week before the official warnings came out. That gives hospitals a whole week of critical prep time.
So the potential here is obviously huge, but the path forward is, well, it's not exactly a smooth ride. To make all this promise a reality for everyone, there are some pretty major challenges we still need to figure out.
First and foremost, and this is the big one, is privacy and security. We're talking about our most sensitive data here. Then there's the fact that the tools themselves are often super complex. You need specialized skills to even use them. We also have to go back to that idea of veracity, making sure the data quality is top-notch. And then you get into these huge, messy questions about standards, about who owns the data, especially when so much of it is trapped in old legacy hospital systems that don't talk to each other.
And all of that, it really leaves us with one final and I think really crucial question. We've seen the incredible promise here, predicting infections, finding dangerous drugs, improving care for millions. But as this technology gets better and better at reading our most personal health data, it forces us to ask, who should get to decide how it's used? You? Your doctor? The hospital? The tech company that builds the algorithm? That is the conversation that we all need to be having as we move into this new world.